Well, hey, everybody. Welcome to CCA's first ever CCA in action, where we are going to be talking with Laura from our clinical operations team. Laura, thank you for being here today.
Well, you're welcome.
Well, why don't you tell us a little bit about yourself?
So, I am a licensed clinical social worker. I've been working in the field for, let's see, I guess about 7 years. And my background before coming into EAP work was doing clinical assessments and working on a crisis line.
Okay, so tell us about this case that you worked recently.
Okay, certainly. So, I took this call a few weeks ago. And so when I answered the phone, they said something fairly generic, like that they were looking to get connected to support and to talk to a counselor. And then as I was asking them for more information and checking in more about how they were doing, they started mentioning that they were having thoughts of ending their life and that they were there at their workplace, that they were at the top of a building at work, and that their plan was to jump off the building. So on the call, it was very challenging for a lot of reasons, not just because of, that setting, and the point that they were at. But, I think clearly they were reaching out and it was a cry for help, but they also, it was hard to keep them on the line. They kept talking about, I don't know that I want to keep talking. I'm just going to hang up and do it.
Hmm.
So that alone, is very alarming. And then the other piece is that it was difficult to get information from them. And so, of course, in this situation, the most important thing to find out is, their name and the location of where they're at. They were willing to provide their name and they provided their employer, but they refused to share the location of the building that they were at. And they worked for, a large company that had a lot of different buildings. So we knew that we needed to find the actual building they were at. But it was a tricky situation, and I think, it was a situation where I just needed to use clinical judgment because based on how they were presenting, I felt like there was a strong chance if I kept pushing about their location that they would hang up the call and potentially jump.
Hmm.
And so instead, what my goal was is to see if either I could build some rapport to a point where they'd be willing to share that, or if we could gather enough context clues to narrow down where they might be at.
So how did you determine where they were?
So what ended up happening is it never got to a point where they were willing to share where they were at. And they said at one point that they were on the roof and that they were specifically next to the helipad. And so from that, emergency services were able to identify the building that they were at. Emergency services arrived. Um, unfortunately, this was a case where this individual did not want emergency services to be called, but obviously we needed to step in and, in doing so, we could have saved their life.
Mm.
So they were honestly not happy that they arrived, but then afterwards we had this assigned to our complex consulting team to follow up. And so they did follow up with this individual and their emergency contact, and we found out they were admitted to the hospital and received treatment there.
That's great to hear. Uh,
Yes.
is CCA staying connected with this individual?
So, what happens with a case like this is whenever there are risk concerns and, a high level of need like this, we get them assigned to one of our clinical teams. Often it's the complex consulting team, like I mentioned. And then they follow up and, from here they would make sure that they have a discharge plan with getting connected to treatment, therapy, medication services, whatever that individual needs. And honestly, most of the time when someone is being discharged from the hospital for inpatient treatment or for, you know, um, psychiatric assessment in the ER, they should have a discharge plan, but sometimes they don't, or sometimes
Yeah.
the individual might reach out for the referrals and they have a very long waiting period. And so, what we can offer is assistance with getting connected and also providing interim support to make sure that, this individual is okay. Maybe if there's a waiting period before their first appointment.
And that's where we are right now with this client is working on follow-up and an ongoing treatment plan.
Right, exactly.
Laura, this work is so important because it doesn't get talked about very much, but it is life and death situations, and that's not an exaggeration. So thank you. Thank you for the work you're doing, and thank you for sharing your story.
Well, you're welcome, and thank you very much.